My name is Brandon Dreiman. I'm a captain with the Indianapolis Fire Department and the coordinator of Firefighter Wellness and Support. And I just wanted to take a minute to reach out to our members and any other first responders who may be watching this video about behavioral health care and some of the things that we have seen in behavioral health care in Indianapolis and nationwide. The last year has certainly been difficult on all of us, and in particular the last month or so, we've noticed an increased feeling of tension and anxiety among our membership. I've felt it myself. Several people I've talked to have felt it. Just know that if you're also having those types of feelings, you're not alone, and it's to be expected. The good news is that there's a lot of hope. We have several resources available to our members, and if you're not a member of Indianapolis, you probably have resources with your agency too, and we're just going to talk a little bit about what might be available. Just don't wait. If you think you might have a behavioral health problem, if you think you may have a substance use problem, don't sit on that. Get help as soon as you think you have an issue. The tried and true method to get better as quickly and as completely as possible is early intervention. So how do we do that? What are the steps that we can take to get the help we need? First, we have a great peer support program with Indianapolis. Reach out to your trained peer supporters. We're not clinicians, we're firefighters just like you. We understand your concerns, we understand your questions on a level and in a way that somebody outside of our agency just doesn't get. So call on us. We're not therapists, we're not counselors, but all of our peer supporters have specialized training in things like crisis intervention, suicide assessment, resource management, and we can help sit down with you and determine whether there may be a problem, and if so, what you want to do about it. And then we can help you navigate the behavioral health resource system here in Indianapolis. The second thing would be our employee assistance program. The city has a great EAP, that's what employee assistance programs are also known as, so Life Services is our EAP. You and every member of your immediate family gets free visits with our employee assistance program for behavioral health concerns. Everything that you talk to in your appointment is protected by HIPAA, so our EAP never reports back what was discussed or who went to go see them. You have absolute privacy in reaching out to them. That same rule applies when you reach out to a peer supporter. Anything you talk to a trained peer supporter about in the state of Indiana is protected by law. So feel free to share whatever you need to share with that peer supporter and know that you can do it confidentially. Maybe you don't want to talk to peer support. Maybe you don't want to talk to the employee assistance program. That's fine. We understand that that's not a great fit for everyone. The option that you can take in that case is reach out to your primary care provider, call your physician, call your nurse practitioner. They can do the assessments that we need to have done. They can perhaps prescribe medication if you need that, but at the very least, you can have a talk with a trusted professional who can get the ball rolling and determine whether or not you may need to take additional steps. It's a great option. If all else fails, call your doctor. We also need to talk about those times when a crisis does arise. Sometimes that can happen very quickly. Sometimes we wait too long to get help and these problems get out of hand. If you find yourself in crisis, or if you find that a family member is in crisis, we have a couple of options. First, if you think that there is an immediate threat to the person's life, or to their safety, or to the safety of others, we have to call 911. Get people there who can de-escalate that situation and get people safe as quickly as possible. And the best option for that is to reach out to 911 and let them know what's happening. We also have a great option through the National Suicide Prevention Lifeline. Suicide Prevention Lifeline is available 24 hours a day, 7 days a week, free of charge. When you call their number, you will get a live crisis intervention specialist who can help de-escalate the situation and talk about the next steps that need to be taken to keep everyone safe. Their number is 1-800-273-8255. If you don't feel like talking to a crisis intervention specialist, you can also text with one. To do that, just text the word HELP to 741-741. That will go straight to a crisis intervention specialist and they will text with you rather than talking to you over the phone. If you want to learn more about the Suicide Prevention Lifeline, you can visit their website at www.suicidepreventionlifeline.org and you can learn all about how they operate and what you can utilize their resources for. Another topic that bears discussion is sometimes whenever we think about peer support in the fire service, we want to limit ourselves to just those things that are happening during our shift. We think about that bad call that we respond to. And that's great. That is a great way to utilize peer support and behavioral health. But we also have to remember that this job doesn't just occur in a vacuum. We have lives outside of this. If you know that a member may be struggling at home, may be having financial issues, may have a sick child, whatever it is, feel free to talk to them at shift change. Talk to them during the shift about what may be going on outside of the job. If you notice a change in a colleague's attitude, if you notice a significant change in their behavior, those are things to make a note about and ask them about specifically. Again, it may not be anything related to the job. Our problems can grow from any number of issues, and they tend to be complicated. Don't be afraid to talk about those issues with the people you love on this job. We are brothers and sisters. We have to act like it. So if you have that concern, talk to them and reach out and encourage them to reach out to peer support, life services, their physician, whatever it may be. But let's start getting our people help, not just for the things that we see on the job, but for the things that may be going on our days off. The bottom line for all of this is that people recover all the time. We suffer and we can get better. You deserve to feel better. And by utilizing the stuff that we've talked about today, you can.